Identifying the patient ensures the right patient receives the intervention and helps prevent errors. Explain the procedure to the patient.
Sir, I will be conducting a vital signs taking to you. Is that okay with you?
Yes.
Explaining the procedure promotes patient's cooperation and relieves anxiety. Close curtains around bed and close the door to the room if possible. Get the thermometer. This is using a digital auxiliary thermometer to get patient's temperature. Clean the thermometer. Disinfect the thermometer using cotton balls with alcohol from bulb to stem. This is to clean the thermometer from area Remove the client's shirt and place the thermometer tip into his or her armpit. Make sure client's armpit is dry to get the most accurate reading. If the client's armpit is sweaty, pat it dry using clean cloth or tissue or gauze first before placing the thermometer. Keep the auxiliary thermometer in place by folding the client's arm across his or her chest. The thermometer will beep when reading is done. This method may take longer than 30 seconds. Remove and record temperature and time. Clean the thermometer with cotton balls with alcohol from stem to bulb. This is to clean the thermometer Discard, use cotton ball in appropriate receptacle. Assessing pulse. Assessing pulse by auscultation. Get the stethoscope. Use alcohol swab to clean the diaphragm of the stethoscope. Use another swab to clean the earpieces if necessary. Cleaning with alcohol deters transmission of microorganisms. Move the patient's clothing to expose only the apical site. The site must be exposed for pulse assessment. Exposing only the apical site keeps the patient warm and maintains his or her dignity. Hold the stethoscope's diaphragm against the palm of your hand for a few seconds. Warming the diaphragm promotes patient's comfort. Palpate the space between the 5th and 6th rib, or the 5th intercostal space, and move to the left mid-clavicular line. Place the diaphragm over the apex of the heart. Position the stethoscope over the apex of the heart where the heartbeat is best heard. Listen for heart sounds. Lob dog. Each lob dog counts as one beat. These sounds occur as the heart valves close. Using a watch with second hand, count the heartbeat for 1 minute. Counting for a full minute increases the accuracy of assessment. Take note of the total beats per minute. Variation. Assessing peripheral pulse by palpation. Select the appropriate peripheral site based on assessment data. Ensure safety and accuracy of measurement. Move the patient's clothing to expose only the site chosen. The site must be exposed for pulse assessment. Exposing only the site keeps the patient warm and maintains his or her dignity. Place your first, second, and third fingers over the artery. Lightly compress the artery so pulsations can be felt and counted. The sensitive fingertips can feel the pulsation of the artery. Using a watch with second hand, count the number of pulsations felt for 30 seconds. Multiply this by 2 to calculate the rate for 1 minute. If the rate, rhythm, or amplitude of the pulse is abnormal in any way, palpate and count the pulse for 1 minute. This ensures accuracy of measurement and assessment. Note the rhythm and amplitude of the pulse. This provides additional assessment data of the patient's cardiovascular status. Take note and record the total beats per minute. Assessing respiration. While your fingers are still in place for the pulse measurement, after counting the pulse rate, observe the patient's respiration. The patient may alter the rate of respirations if he or she is aware they are being counted. Note the rise and fall of the patient's chest. A complete cycle of inspiration and an expiration composes one respiration. Note the depth and rhythm of the respiration. This provides additional assessment data regarding the patient's respiratory status. Take note the total cycles per minute. Assessing blood pressure. Select the appropriate arm for the application of the cuff. Have the patient assume a comfortable lying or sitting position with the forearm supported at the level of the heart and the palm of the hand upward. If the measurement is taken in a supine position, support the arm with a pillow. In the sitting position, support the arm by using the bedside table. The position of the arm can have a major influence when the blood pressure is measured. If the upper arm is below the level of the right atrium, the readings will be too high. If the arm is above the level of the heart, the readings will be too low. Expose the brachial artery by removing garments or move a sleeve if it is not too tight above the area where the cuff will be placed. Palpate the location of the brachial artery. Center the bladder of the cuff over the brachial artery about midway of the arm so that the lower edge of the cuff is about 2.5 to 5 centimeters or 1 to 2 inches above the inner aspect of the elbow. Pressure in the cuff applied directly to the artery provides the most accurate readings. If the cuff gets in the way of the stethoscope, readings are likely to be inaccurate. A cuff placed upside down with a tubing toward the patient's head may give a false reading. Wrap the cuff around the arm smoothly and snugly and fasten it. Do not allow any clothing to interfere with the proper placement of the cuff. Estimating systolic blood pressure. Palpate the pulse at the brachial or radial artery by pressing gently with the fingertips. Palpation allows for measurement of the approximate systolic reading. Tighten the screw of valve on the air pump. The bladder within the cuff will not inflate with the valve open. Inflate the cuff while continuing to palpate the artery. Note the point on the gauge where the pulse disappears. The point where the pulse disappears provides an estimate of the systolic pressure. To identify the first corrupt of sound accurately, the cuff must be inflated to a pressure above the point at which the pulse can no longer be felt. Deflate the cuff and wait for 1 minute. Allowing a brief pause before continuing permits the blood to refill and circulate through the arm. Take note of the estimated systolic blood pressure. The estimated systolic blood pressure is determined by the pulse first felt upon palpation during the deflation of the cuff. Obtaining blood pressure measurement. Assume a position that is no more than 3 feet away from the gauge. A distance of more than 3 feet can interfere with accurate readings of the numbers of the gauge. Place the stethoscope earpieces in your ears. Direct the earpieces forward into the canal and not against the ear itself. Proper placement blocks extraneous noise and allows sound to travel more clearly. Place the bell or the diaphragm of the stethoscope firmly but with as little pressure as possible over the brachial artery. Do not allow the stethoscope to touch clothing or the cuff. Having the bell or diaphragm directly over the artery allows more accurate readings. Heavy pressure in the brachial artery distorts the shape of the artery and the sound. Pump the pressure 30 millimeters of mercury above the point at which the systolic pressure was palpated and estimated. Open the valve on the manometer and allow air to escape slowly, allowing the gauge to drop to 2 to 3 mm per second. Increasing the pressure above the point where the pulse disappeared ensures a period before hearing the first sound that corresponds with systolic pressure. It prevents misinterpreting phase 2 sound as phase 1 sound. Note the point on the gauge at which the first faint but clear sound appears that slowly increases in intensity. Note this number as the systolic pressure. Read the pressure to the closest 2 millimeters mercury. Systolic pressure is the point at which the blood in the artery is first able to force its way through the vessel at similar pressure exerted by the air bladder in the cuff. The first sound is phase 1 of corruptive sound. Do not reinflate cuff once the air is being released to recheck the systolic pressure reading. Reinflating the cuff while obtaining the blood pressure is uncomfortable for the patient and can cause inaccurate reading. Note the point at which the sound completely disappears. The point at which the sound disappears corresponds to the beginning of phase 5, corruptive sound, and is generally considered the systolic pressure reading. Allow the remaining air to escape quickly. Repeat any suspicious reading but wait at least 1 minute. Deflate the cuff completely between attempts to check the blood pressure. False readings are likely to occur if there is congestion of blood in the limbs while obtaining repeated readings. When measurement is completed, remove the cuff. Take note and record of the blood pressure reading. After taking the vital signs, cover the patient and help him or her to a position of comfort.
You're comfortable, sir.
Yes, thank you.
Make sure the side rail is raised. This ensures patient safety and prevent fall. Do aftercare and remove gloves if worn.
Thank you, sir. I will be going now.